Joined now by U.S. Admiral Brett Giroir, a key member of the White House Coronavirus Task Force. Admiral Giroir, thank you for joining us this morning. I know you're responsible for testing. There's so much to cover across the country. We want to get to that as well. But I want to begin with that warning from Surgeon General Adams yesterday saying America should be braced for a Pearl Harbor moment this week. He reports to you. Is that how you see it right now? What should Americans know?
Well, good morning, and I think the Surgeon General was absolutely right. For parts of the country, particularly New York, New Jersey, Connecticut, Detroit, this week is going to be the peak week. It's going to be the peak hospitalization, peak ICU week, and unfortunately peak death week. But that doesn't mean we're over this week. There are other parts of the country that will peak a little bit later, like New Orleans. So we have to be very, very serious about what's happening this week, next week, the following weeks. Do the physical distancing, wear the masks. That's how we're going to defeat this virus.
That's all the prevention and the mitigation. There's also a lot of questions about treatment as well. And this possible treatment, hydroxychloroquine, give us your best scientific judgment now about what people should know about that drug right now. You're a pediatric ICU surgeon. Would you prescribe it to your family, to your patients?
Well, I think the decision to use hydroxychloroquine is between a physician and a patient. It is a drug that's approved. We know a lot about it. It has some side effects, and it could be used off-label. Any drug that's approved in the United States could be used for any indication that a physician thinks. And it's a risk-benefit analysis. If a person's really sick and about to go on a ventilator, the risk-benefit calculation in my mind is probably you would probably use it because going on a ventilator, being on all the things we do in the ICU are also very risky. But it's really an individualized decision, and I think it's being made often throughout the country. And we're going to support physicians, doctors, pharmacists by making sure that the supply is there throughout the country should a physician and a patient decide that's what they want to do.
Let's talk about where things stand with testing right now. The United States is clearly behind the curve at the beginning of this pandemic. Where do we stand right now? And just as important, where do we need to be if we do indeed want to move towards reopening at least parts of the country on May 1st?
So where we are right now is, as you said, we've come a long way. As of yesterday, we've conducted at least 1.67 million tests, and we don't even get information from all the laboratory-derived tests. These are the ones that are in the hospitals that don't really report up through the system. We'll do about 1 million tests this week, and that's plenty enough tests for the people who really need it in the priority groups, those who are hospitalized, healthcare workers, elderly. When we get to the next phase about reopening the country, it will be a combination of the kind of tests we do now plus something called serologic tests. And serologic tests are on a drop of blood. They're very, very quick. They will be scaled to the tens of millions very quickly. And they will tell you if you've been exposed to the virus. So have you had the virus? That's very important as we think about reopening the country and the economy, because if you have had the virus and you have an immune response to it, in all probability, you are immune and safe from the virus. So it'll be a combination of the active test for the virus.
Are we going to be able to ramp up to those tens of millions by May 1st?
For the serologic test, we're very optimistic. There are several that are going through the FDA right now. I just want to be a little bit cautious, though. We want to make sure that these tests are highly validated and their performance is excellent, because we don't want to tell a person, yes, you've had it and you're immune, and that's not the case. So we are very optimistic. I'm personally very optimistic that by May, we're going to have these in very large quantities with all the needed supplies. The current tests have a long supply chain, swabs, media, testing, lab kits, et cetera. The next phase is much simpler.
Finally, sir, we saw that report this morning about at the Bronx Zoo, an animal testing positive for COVID. What should that tell people about whether their pets can get it and vice versa?
Well, I think it's the idea of pets. We have to learn more about that. There is some CDC guidance that is posted on pets. Hopefully, no one has a pet tiger, but clearly. there could be a potential of some species. Coronaviruses are a very wide class of viruses, not this specific one, but there's a very, very wide class that infects many different species around the world, which is why you've seen this transmission to us. So check the CDC guidance for updated information about your pets. That will change as our information evolves.
Admiral, thanks very much for your time this morning.
You're welcome.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.